Coordinator for the EHR Incentive Program, and we are really excited about this opportunity today. We're glad to see so many people here, and we appreciate you taking the time out of your schedule to come and be with us. This is our first annual, and you notice I say first annual because this is going to be the first of many Health IT Symposium, Health Information Technology Symposium, HIE initiatives, whatever you want to call it. We are just glad that you are here. We definitely want to thank our sponsors, the FMA for our CME credits, FOMA for our breakfast, Strategic Health Intelligence for our breakfast, and Harris Corporation for some of the other things that you'll be seeing and getting today. We have some great panelists. All of that information, again, is in your program. I do have a hot off the press announcement if Pam's in here.
I'm here.
Oh, okay. Is it okay to make the announcement?
Yes, it is.
Okay. So I am pleased to announce that Community Health IT is our newest PLU partner. I think they started validation process just last night, so we're real excited to have them on board. They're going to be one of the entities that are onboarding individual physician offices. As we've been out talking more and more to individual practices, more the local physician level, that has been a real need that's been identified, so we're really happy to have Community Health IT on board and offering that service along with Strategic Health Intelligence, and is that it?
Tampa Bay.
And Tampa Bay HIE. Okay. So, hot off the press. So that's all of my announcements. Any questions? Well, I really am excited about today. I've worked in this arena for more than a few years, and it's really exciting to see all of the things that have happened. It's been a long time coming. We still have a long way to go. But I really trust by the end of the day, you'll find out all the exciting things that are going on, not just here in Florida, but all across the nation. I trust that you will make the connections that you need to find out more, to find out how you can be engaged, to find out how you can kind of bring these services to your area, to your local level. And what's more importantly, I really trust that you'll go away knowing that you're part of something bigger, something that is truly transforming healthcare today. So Secretary Dudek.
Good morning. How's everybody? Good. Okay, casual Friday. Well, some of you didn't get the message, but thank you. I'm Liz Dudek, Secretary of the Agency for Healthcare Administration, and I'm going to do a little introduction. I do want to tell you that the agency is not only Medicaid and LIP. It is not only moving 3.8 million recipients in some form or the other to managed care, actually probably about 3.2 to managed care and the rest in another form. It's not only about regulating 45,000 healthcare facilities, but it's about how we can use technology, how we can communicate, how we can use technology to communicate better, to get better results and improve quality for all of the individuals that we're responsible for in one form or another. I want to thank each of you for joining us today, and I especially want to give recognition to the physicians, attorneys, consultants, health plan representatives. I see a couple, I recognize you, and I saw you talking to her, who's heard you were with a plan, so I was listening. I don't always appear to be doing that, but I was. But thank you for being here, sharing your knowledge and your experiences. Thank you for your commitment also to supporting the creation of different and integration of different technology into our modern healthcare system. It's no doubt that it's a challenge. It's a challenge that has benefits. It takes a lot of work. It's not cheap. One of the things when you go, even when staff comes to me when we're preparing a legislative budget request and then we have to move forward to the governor's office or to the legislature and talk about something, they're like, well, it's only an IT system. How much can that cost? And can't you just fix it? And I will do that with our huge FEMA system. Can't you just tweak those things? Can't you just add this field? Can't you do this? No, you can't just do that, and you don't want to just do that because it won't always work. We want to talk about some things, and I think you'll hear about some things today. I had the opportunity the other day to talk about, how things have moved in time, and I was telling somebody about how to use their Blu-ray DVD player instead of having to buy a smart TV, get a cheaper DVD player and use that in that process. And I think back to when you had, some people might not remember, my parents had LP, huge, the 78s. Then we went to 45s in terms of records. Then there was the infamous 8-track player. my mother held on to those for years because my mother was a huge Hendrix fan. She hated Zeppelin, she loved Hendrix, so we always had Hendrix at home, and she had the 8-tracks. Till we went to cassettes, till we went to CDs, and I think about the first computers at the house. I'm not really great on a computer, but I remember when you did it by cassette, and then, oh my gosh, you got a single-sided floppy disk, and then you got a hard disk, and now where you just plug in whatever that little thing is, and everything happens. And so it is wonderful to see what has happened with technology. I want to tell you a little bit about, as an introduction, what we're doing at the agency with technology. Florida Health Finder, we've got a booth out there. FloridaHealthFinder.gov, about 15 years ago, we started that at the agency. We did not realize what we had and what a jewel we had and how much that could grow. It's nationally renowned, and actually I was able to impress the governor because he asked us to have some of his friends talk to us about different data systems and how we could collect data, and they all came back and went, don't you know what you have? You have this really, really, really good thing in Florida Health Finder. It is able to have individuals compare different types of performance metrics, pricing information, learn about medical conditions and procedures and tests. Actually, we were talking outside about individuals who look and how the experience with like pharmacy, which is a big issue for everybody, how there may be a difference in certain medications, even here in Tallahassee, like $100 difference. And if somebody knew that, would they not drive that couple of miles or across town if they could to get it? Last year we had over 3.2 million hits, and I think it's actually larger than that, to the site. Now granted, a lot of that was me. Okay, where's that facility? What did those people do? And I will tell you, if you've been watching the Commission on Healthcare and Hospital Funding, we've been hitting that a lot, as they have, but there's fabulous information there, and if you ever happen to get a program called Tableau, and you have that information, you can do all of these incredible things to look at what's actually going on. So it's a wonderful, wonderful tool. We have a mobile app that you can put on your phone. I've got on my phone. When in doubt, we use that to find where we need to go. But for healthcare facilities, you can find out everything about what they did or shouldn't have done, who they serve, where they are. You can find out about how their practitioners perform the procedures they do. There's information on charges. We figured out lately that that really is an indicator of anything, but a lot of information. But it's commonly cited as a leading source for quality metrics. Our background screening clearinghouse, called the Care Provider Background Screening Clearinghouse, was originally brought up in 2013 for us and the Department of Health, because we would have a physician who had to get background screened to be a doctor, who wanted to be a Medicaid provider, who had to get background screened for Medicaid, who wanted to own a healthcare facility, had to get background screened again. 3 different screenings. What a waste of time. We also had a process back then by which once you got screened, you could do whatever after that. We didn't catch it till the next time you had to get screened. Well, all that has changed. We have all but 2 of the Health and Human Services agencies on board. Our managed care plans are on board. Medicaid is on board. So we can literally share all of that information. And to date, we've saved about $5.5 million to not only the individuals who have to be screened, but the providers who employ those individuals. It's improved our efficiency as well as allowed us to find out about those people who, and they do this. I mean, I look at the background screening. They're good up to a point. You have to be good for 3 years. They get the screen, they're good, they turn around and they don't go rob a bank, but they, do something else. And you're like, what? So between them and the people who really messed up during the 70s and the 60s, where you go, oh, really? It will follow you everywhere. Tell your children it will follow you everywhere. Our Florida Health Information Exchange, and there's just been recent information about that. We have a portfolio of services offered through the exchange, and it focuses on interoperability and the flow of patient information through multiple levels of care. Originally implemented in 2012, the Florida HIE is comprised of the PLU, Patient Lookup Service, Direct Messaging Service, DMS, and the Event Notification Service, ENS. These systems work to partnership with Florida's healthcare providers to lower costs, improve efficiency, reduce medical errors, and provide better care and service to patients. I know that you'll hear more about what's going on with the exchange during some of the panel discussions this morning, but I wanted to let you know about some of our successes. Again, what you can do is find out if you're a plan, if you have a nursing home resident who's admitted to the hospital for treatment, the ENS would alert you about the individual's health, would alert the plan upon their discharge back to the nursing home. These types of automated notifications greatly improve the coordination between multiple levels of care, resulting in greater accountability. To date, over 200 hospitals and over 900,000 patients, not to mention 80% of all Florida hospital beds, are in the ENS system. It's also a requirement of the participation for some of the hospitals, to get, what did I mention, that LIP program, to get those monies. That participation was a requirement for them. Collectively, the Florida Health Information Exchange is connecting providers within the state and between neighboring states, helping us minimize or eliminate redundant testing, and generally improving the quality of care received by the patient. You can tell what parts somebody helped me with and some parts where I kind of go by myself. It's a Friday morning, I got to tell you, and I was in casual mode. I want to really thank you and tell you how happy I am that we have so many people interested in this and so many people sharing. It's not an area I know as much about as I would like to. I'm going to spend time this upcoming year. That's one of my goals for myself, is to get a little bit more involved in what actually happens, other than going on Florida Health Finder a lot. But the future of healthcare is bright, I think, with all of the technology that we're looking at. And we don't need to change just to change, but where we can change to improve not only our communications, but the resulting effect onto the individuals that we serve, I think would be a great thing. Please share your ideas, talk to each other, network, and please do give us the benefit of your ideas and what we can use to move forward with our systems as well as the systems that we all utilize. So have a great Friday. I'm going to go play with those other areas of that I mentioned earlier of the agency, and enjoy yourselves. Thank you.